Hi guys, divergents and typicals viewers watching. I'm Jordan and today I'm going to talk about the stem cell therapy I underwent about 2 years ago. Soon after I had my diagnosis already by the doctor in Turkey, I understood that there is an option for a stem cell treatment in the hospital in Turkey I was first examined. Another doctor who was the geneticist there, and he's a friend of a family friend of ours, the reason why I went to Turkey actually, so thanks to her. He told me about a guy who is about 35 years old, so maybe he's around 37 now, who has Asperger's and who did the stem cell therapy. Before that, he had a lot of issues, especially with social communication skills. He was unable to leave home, he was unable to sleep at a friend's place, and it was nearly impossible for him to leave the city. He was that much reluctant to communicate with anybody. It was impossible for him to leave his city and not to be able to come back for the night. You can imagine the level of stress that must have caused the guy. So he had recently done his first infusion of stem cell therapy, and his reason for doing it was to get off his meds. So it was about 1 month after his first infusion, and he had already decreased his meds by half. He was surprised that he was able to spend the night at a friend's place. Moreover, it was outside of his city. So hearing that story, I was immediately hooked. I decided I'm gonna do it no matter what. So I filled in some documents, and in a month or so, in September 2022, I had my first infusion. So what was that stem cell therapy after all? It was a newer kind of stem cell therapy where they don't actually inject you with stem cells, but just the liquid from it. So it's much more bearable for your body. Moreover, there is no chance of developing cancer afterwards. And most stem cell therapies have that risk. So yeah, it is called exosome stem cell therapy. About the equivalent of 200 million stem cells are injected into your spine. For me, they injected it in my lower back. The reason for this, as far as I know, is that one theory suggests that autism might occur as an autoimmune reaction, meaning that certain proteins are not properly synthesized in the stomach. So when they go up the head, they cause behavioral problems, such as difficulties with social communication skills. I have a feeling that the neurotransmitter GABA is involved in there, though I'm not sure about it, just a speculation. After all, it's the hormone that relaxes you, makes you calm in stressful situations. It's part of the parasympathetic nervous system arsenal. So anyway, I was there in the hospital at the end of September 2022. So in about an hour, I had already woken up. I could feel immense pressure on the lower side of my back, however, it still didn't hurt. So still, under the influence of the anesthesia, I just wanted to go out and walk. I didn't want to stay anymore in the hospital. My father was with me, so he agreed for us to have a long walk, even though the doctor suggested not to. But I felt no pain, no anything, just a little pressure. After the walk, we went to have dinner, and then we did another longer walk, probably for more than an hour and a half. After all the walking, I was pretty tired and calm, so we went to bed. And I had no idea what's coming the next day. The next day, I woke up with muscle pain I had never ever had before from any kind of exercise. I'm pretty sure it was because the anesthesia was already completely gone and I could feel all that pressure in my back. We called the doctor to ask him what is happening and to tell him how I'm feeling. And he said, alright, that's completely normal. And he advised me not to take any painkillers whatsoever, because anything and everything might interact with the stem cell therapy. So here it's time to say that I was under a strict regime afterwards for the next 2 months. I had a special diet. I wasn't allowed to smoke because, as I mentioned, there weren't any risks of cancer, but just by protocol, they didn't want to stand a chance. And since the lungs are the most vulnerable part, and probably a part that reacts a lot to the stem cells themselves, I wasn't allowed to smoke at all. And back then, I was still hooked on weed. So I had to be honest and told the doctor that I used weed, and I asked him how to consume it so that it doesn't fuck with the stem cell therapy. Luckily, he said I can eat it. And moreover, he said that cannabis is actually beneficial to the stem cell therapy itself. I was amazed. I now had my reason to do it. In about 6 months, I actually finally managed to stop weed. But this is a topic for another video, and I'm definitely gonna tell you about it. So back to the stem cell therapy. My back and my waist hurt for the next 5 days straight. And the worst part of it, on the second day, we had to go back home to Bulgaria by car. It was the most horrific ride I have had. Plus, I couldn't even take anything for the pain. The good news though was that I'm gonna be able to cook and eat some weed when I get back home. Although I did it the next day because I was completely exhausted. It was a 7-hour ride and we had to wait at the customs, and every once in a while I was just screaming and crying from pain. 2 months later, in November, I had my second infusion. It was also around the equivalent of 200 million cells. I expected this to be a little lighter experience. However, it turned out to be the same hell as last time. The only good thing was that we were staying in Turkey for a whole week. So we were traveling on the 7th day, where I still had a little pain left, but most of it was gone on the 6th day. Probably from the horrific ride home during the first infusion, the whole period lasted for 9 days, until I didn't feel any pain whatsoever. Except for the pain, in the next few days you feel really exhausted. So unlike last time, after the operation, during the first day, I didn't take such long walks. Even so, that didn't matter for the pain. Though, because I was expecting it somewhat, it was much more bearable. Even so, I was unable to walk for a few days for more than a few hundred meters. And I'm used to walking about 10 kilometers a day each day. So you can imagine what a pain in the ass that was for me. I wasn't also able to eat properly, and for the last 3 days I had a horrible diarrhea. So I was only eating rice with a little salt and veggies. So, moving on to the main question. Did the stem cell therapy actually help me? Yes, it did, but at the same time, not as much as I expected. It managed to decrease my noise sensitivity a bit, to the point that I wouldn't get a meltdown 2 or 3 times a day from sudden loud noises, how I used to. However, if the noise is persistent and is going on for more than half an hour or an hour, I would have to move away and change places so that I would avoid a certain meltdown. My sensitivity to light and to touch also decreased a bit. I remember these new lights that were installed in my neighborhood, very bright white light. They used to get me to melt down a couple of times a week and I couldn't handle it. Nowadays, they still agitate me, but when I move past them, it's kind of gone in a while. So next thing is social and communication skills. Did the stem cell therapy help there? I think yes, but here I expected a bit more. I'm still much more willing to engage in conversations that seemed very uncomfortable for me in the past. However, it's definitely not completely gone away. It's not even gone away to the point I wanted it. So it still makes me nervous when somebody is coming home and I have to welcome them and I wonder for 15 minutes how I'm just gonna say hi to them and calculate the various small talks that person might go into for no reason whatsoever. I didn't see any change with pursuing my special interests or having a routine. And about stimming, there is probably a little chance that it helped. However, I had stopped consciously before that so that I wouldn't deplete my dopamine and my GABA. Yeah, you can actually teach yourself how to not stim in certain situations, and over time, this can make you much calmer. Anyways, the things that the stem therapy really helped me with are my noise sensitivity and my social communication skills. It didn't help as much as I expected, however, it did alleviate my struggles a bit. So now I can sleep better, I can stay calm in certain situations where the environment is noisy, and last but not least, it is a bit easier to communicate with people, even sometimes with crowds of people, but just for a short while. Okay guys, so that's it for the stem cell therapy. I wouldn't suggest anyone to do it or not to do it because after all, it's an expensive operation. However, I wanted to share my results if anybody is interested. There are a lot more cases you can watch on YouTube of people who have autism and did the stem cell therapy. There are people who are pleased with the results and there are those who are not. So you can make your own conclusion if it's worth doing it. I thank you guys for staying with me, and may peace be with you.